Hello, and welcome to FSR's webinar, the Foundation for Sarcoidosis Research Wellness webinar on sarcoidosis and sexual wellness. I'm Mindy Buchanan, Director of Patient Programs, and I'll be the moderator today. First, I would like to thank our sponsor, Mallinckrodt Pharmaceuticals, for their support of our efforts and our awareness programming throughout the year, including these webinars. So thank you to Mallinckrodt Pharmaceuticals. And next, I'd like to go over some housekeeping. So this is a webinar and we will not be able to see or hear audience members. This means if you use the raise hand function, we are not able to respond directly. The chat feature works only as a direct message to the speaker and myself, the moderator. So feel free to use this if you'd like to chat to us directly. I will be able to chat with you in the audience, and that's where I'll add any links discussed during the session. We'll also send out the links in the post-event email along with the locked PDF of the slides and anything else we shared during the webinar. You may send your questions throughout the webinar via the Q&A feature as well. You have the option of submitting a question anonymously if you prefer to do so. As questions that are answered during the session will filter into the answered section of the Q&A box where the full audience can review them. So do decide if you want to submit your questions anonymously at the time you submit them. If you have any technical difficulties, please chat me directly and I will do what I can to help. It's now my pleasure to introduce our expert for today's webinar, Jillian Bisar. Jillian has 19 years experience as a social worker and sexual health advocate. Ms. Bisar is a member of the Sexual Health Alliance, Association of Oncology Social Workers, and the National Association of Social Workers. She's trained in comprehensive lifespan, inclusive sexuality, and health relationship curriculum our whole lives. She has worked in a variety of settings to provide sexual health education, counseling, and relationship support to clients. She has worked in chronic illness, HIV, oncology, and with persons living with developmental disabilities, helping clients to navigate healthy, fulfilling sexual lives. She is passionate about educating and advocating for fulfilling lives through healthy relationships of all kinds, as well as access and inclusivity in sexual health. Her approach is sex positive, evidence-based in science, and grounded in relationship therapy techniques. Welcome, Jillian.
Thank you, Mindy, so much for having me here. I'm really excited to join you all today. I'm going to start by sharing my screen. So let's hope I get the right screen on here. There we go. All right. I think we did it. Excellent. So we will start today. And I always like to start this off with kind of grounding us as we move through this. Sexual health and sexual well-being can be a topic that can bring things up for people. So I want to make sure that as we move through this presentation today, that we are all taking care of ourselves. Some topics that we bring up may feel new or uncomfortable. If you're finding yourself feeling uncomfortable, you can discern for yourself if it's good for you to lean in a bit and if this is an area of growth for you, or if you need to do some self-care and step away. And that's either step away completely or momentarily. And so I want to make sure that you guys are all taking care of yourself and that, we are making sure that if you need to be in a safer space that you are there. All right, let's just check in the chat there. Mindy reminding everyone how to get a hold of us if we need us. Okay, so a little bit about what we're going to speak on today. So these are our topics. We're going to start by assessing the situation. And so I'm going to walk you through a little bit about, what you can be looking at in your own lives, what you might want to be thinking about, the process of thinking through what you may have lost in your sarcoidosis journey. And it's important to acknowledge that. Then we're going to get a little meta. We're going to look at and acknowledge change, and then we're going to identify opportunities and choose a path forward. Right. So just a disclaimer that I receive no benefit for recommending any certain books or resources or tools. I get no kickbacks for any of this, no financial gain in any way. I do this because I feel like this is important work and that we do not talk about sexual well-being in general in society. And we especially do not talk about it in spaces of chronic illness as much as we should or at all. And then anything that I do endorse here, a tool, I've found it to be beneficial in the work with my clients. So I have gotten real life feedback that people have found some of these things beneficial. And my endorsement of any one tool or a body of work is not necessarily an endorsement of that person's entirety of their work, either now or in the future, just so that you know. So, all right. So first, we're going to sit back and I'm going to walk you through this journey of assessing the situation. And based on some of the pre-information that Mindy sent me from participants, it looks like you guys have done some very good assessment. You know where you're at. So that's good. What I want you to do today is to put on a hat and assess it with a different lens today. So the first step in our journey is to take this assessment. And where are we right now with our sexual selves? What do we want? What do we need to get to where we want to be? How will we know when we get to that point? So taking this first step can be scary. You may be trying to discern things because you're not sure where you want to go yet, or if it's even possible. I want to start with our guiding principle, and that is that everybody is a sexual being from birth to death at an age-appropriate and stage-appropriate level. From there, we can extrapolate that every body deserves pleasure and positive sexual experiences at an age-appropriate level. In our early years, this includes learning the proper names for our body parts and how they work. Some of us may or may not have had that. And that we have a right to decide who has access to our body, when and under what circumstances. For some of us, our struggles with our bodies and our sexual selves and consent and body autonomy may have started off in a strange place. As we learn today, and maybe sometime after, I want you all to take the time to reflect on the questions we've posed here so that you're clear on what you want or what you need. So some of this, you may be taking some notes. You might be thinking through some things about what you want, and then that will help you when we get to the choosing a path forward portion. So this is kind of the putting on a different lens. And this may be a very different lens than a lot of people typically think of when we think about sexual selves. So sexuality encompasses nearly every aspect of our being, from attitudes and values to feelings and experiences. It influences individuals, families, religion, cultural, spirituality, it's laws, professions, institutions, science, and politics are all influences on our sexual selves. As we age and grow, no matter who we are, our bodies will change. Every body changes, and every person has different changes that they may have to deal with throughout their lifetime, big or small. What we do know is that as each of us lives our lives and things happen to us, we have the opportunity to change and grow with our bodies. Some things we may have to embrace that we do not want to. This is not to say that there are not bigger hurdles to get over in some situations, like a chronic illness. But this is all part of life. Many of us are taught to think very narrowly about what sex is and what it is not. One of the biggest tools we can use as we grow and change and adjust to what has occurred with our bodies and our minds over time is to remember that we have the ability to think outside the box. So right here, you'll see a visual of the circles of sexuality. You may not be able to see it super duper well, and I can provide this printout as a separate piece to Mindy so that it can go out in that email. But what I want you to know is that this is basically the thinking outside the box. We're thinking in circles, the circles of sexuality. And so we want to make sure that we're thinking about sex not narrowly. It's not just one kind of act, but it is the whole umbrella of sexuality. And there are many, many pieces of that. So there's sensuality, there's skin hunger, that need to be touched, that need, that snuggle need almost, right? Visual stimuli, the sexual response cycle, which I will elaborate on more in a minute, body image, fantasy. We have intimacy. So this is caring, sharing, liking, loving, risk-taking, vulnerability, self-disclosure, and trust. This is your own sexual identity. So your biological gender, your gender identity, your gender roles, sexual orientation. We have sexual health and reproduction, which is, that circle's typically where people's minds go. That's the one that pings for us first. We have sexualization. So, it's acknowledging that some of this could be flirting, but it could also be all the way down to harassment or rape or incest and things that are, on the unpleasant side of this spectrum. We have to acknowledge that these things can happen and that it's part of all of certain people's journeys, and that in part of this whole process, you kind of have to look at and acknowledge that whole package for yourself. And each person has an individual story around this. So in that, assessing the situation is the process of setting your own mind right to utilize the tools and practical options that can assist you in embracing your sexuality and your intimacy. For some, this can be done with tools and guidance. For others, this may require professional assistance from a therapist or someone who is trained in sexual health and chronic illness. Not every therapist is trained or comfortable in these subjects, so that's an important thing to find if you feel like you're going to need some more professional support around it. And then some tools that would be helpful in exploring some of this on your own. If you like to read, I really love the book by Emily Nagoski called Come As You Are. Now, the only downside that I find to this book is at present, it is more facing to those who identify as female. However, it doesn't, the concepts are universally applicable. It's just, it was written more towards the female population. So, and there is also a too long didn't read section to share with any pals in that book. And there's a workbook that goes along with it. But the premise of her work talks about learning about your own response cycle, basically. So what are the things that help you embrace your sexual self, and what are things that really short circuit that cycle? And some can be very obvious, and some maybe are more psychological and not as obvious. So things we have to attend to first as we're assessing ourselves in the situation are there beliefs from before or after diagnosis that are compounding the situation? So beliefs about yourself or beliefs about sex in general, who can do what sex even is, what falls under that category. And in this process, I really want you to start thinking about sex as a much more expansive thing than we traditionally tend to talk about it as. So are there existing confining or maybe negative ideas about sex and relationship roles? Maybe these come from culture or religion or education, and also from maybe your personal past, perhaps maybe unpleasant or negative experiences. We have to identify these things so we can honor them, even when it might be kind of uncomfortable for us. And then again, we have to attend to, are there trauma experiences? Are there things before diagnosis? And I have cancer here, but I forgot to update this for, sarcoidosis or chronic illness. You could put this in there for any of those things. I just missed that on this slide. Because a lot of these needs mirror each other across. I've seen this in many of the disease processes that I have worked in, where people need to attend to their trauma first before we can pull in the experiences that have happened, and also the diagnosis as trauma, the experience of the lived chronic illness as trauma, and how do we address that? And we have to address that first, so that we can do some healing in that area. Because there can be a lot that comes up around that, a lot of anger, a lot of shame, a lot of frustration, and how do we embrace that in a way that is healthy and move through it instead of suppressing it. And then once we've attended to some of those things, we can start looking at acknowledging change. So change in sexual desire, change in body image, change in identity, shift in role or autonomy, energy, function, any corresponding anxiety, depression, or whatever else comes with the mental load of a chronic illness. And acknowledging these things, we may not have fully, it, you live it, and sometimes you're so in it that you haven't fully embraced all the things that are there. Because it can be very painful to look at that and say, I am going to go eyes wide in and look at what I'm dealing with. But again, this is to identify it so that we can embrace it and we can move forward. We can move through it. We can work with it. Because sometimes the things that are stopping us are the things we didn't fully acknowledge. And then a nice ritual that you can do for yourself is actually grieving losses. This is something in my clinical practice that I've done with patients. And that, again, they're so in the process of whatever they're going through and just managing the day-to-day, which can be very exhausting. I will acknowledge that. But they forget to really grieve and have that full cycle. So Emily Nagoski talks about this in her book, Burnout. But when we have traumatic things happen, when we have something that is, it's a disruption to our nervous system, we have to complete the cycle in order to fully get it out. And so sometimes we haven't fully grieved these losses that we may have. And these are just some examples. There may be many, many more. I probably could fill pages with them. But, these are just some. And truly, even have a ritual around that for yourself. I find that when you slow things down a little bit and you take the time to honor the place that you're at and to grieve that loss, you don't stay stuck there, right? It's a reality you live with, but you don't stay stuck there. And a lot of times we haven't done that full work to complete that cycle. So you may want to make your own list. And, I saw even in the pre-screen questions and things people want to, one of the things, and of course, when I say loss of identity, who you were, but it can also be a change in relationship status. So either a change in roles, maybe you were the one who always did all the things, and now maybe a partner is caring for you. Perhaps you've lost the relationship over time because they were not willing to step up and do the things that were needed to support you. And this can be romantic or otherwise. So this includes friendships and other social supports. Because a lot of relationships, people expect reciprocation. And when you are dealing with a chronic illness, that is incredibly hard to do at the level that people who don't know might expect. And so that is something that we maybe have to acknowledge happened. And sometimes we may not even realize how quickly that did happen, or maybe people fade slowly over time, depending on how that comes. So it may just not be as noticeable in the immediate. But do some sort of ritual, write it down, let it go, like embrace it and find a way to move through it, to let it go. This is where I am now. This is what I have been through. This is who I am. And then we can have a place from there where we have a footing to move forward. So here, this is where the hope comes in, right? And I know we concentrated on a lot of the losses and things people may have experienced, and that can be very uncomfortable. We will acknowledge that. But again, we have to do that so that we're not stuck there. We've acknowledged it. We've honored what we've been through. And we have a footing for what we need. We've gotten very clear about what we need and what we want and how we'd like things to look. And that's the place where we have to identify opportunities and create hope. All right. So this is where we get to redesign. We get to redesign what sex means in our lives, right? It's the diaspora of things that are on the table, right? It's not just goal-directed sex. So a lot of people really think about it's not sex unless there's an orgasm. Well, for a lot of people, that's not going to be a thing. And then there's multiple issues that people may have in life where orgasm's not, nor should it be the culmination, the pinnacle, the be all and end all. We get to redesign, and we get to redesign what's on the table. So it's all of those things. I don't want people to think about foreplay as foreplay. It's all on the menu. It's not an appetizer. It's not a lead up to. These are all sexual acts, and some of which are more accessible at different times than others. Like I said, we think very narrowly about sex, and oftentimes that's some sort of penetrative sex. Either to humans with their corresponding parts, or with objects or toys, assistive devices and things like that. But it doesn't have to be that. It is all of the things on the menu. And so we can redesign. We can decide what's going to work for us. So, and this also has to do with relationships. So relationship with your own self. Have you spent time exploring your own self and what you need physically? What feels good, what doesn't feel good? I went to a workshop once, and this was a workshop in communication between partners, but it can be applied to yourself. Have you, what feels good any given day or any given time? Do you like having your back rubbed or not having your back rubbed? Do you want it up and down or in circles? Is it okay for someone to touch your knee or your thigh? But some of this you can do even on your own. What feels okay on your body? What would feel great on your body? What wouldn't feel good? And get really comfortable with that for yourself, because in redesigning, in rescripting, either with an existing partner and or new partners, you have the opportunity to be directive, to ask for what you want and what you need. And that's the only way you're really going to get any closer to what you want. And some of it is then, once we've asked, experimenting with it with someone else that we are comfortable with, if we've invited them into this space. A lot of people tend to have these scripts that they follow, or this narrow view, or this is what we always do, or we always did. And then they get any sort of chronic illness or new diagnosis, or even any sort of life event. And then oh, well, that's on the table. And so then they move away from doing it at all. Instead of maybe unscripting, taking that script off, rethinking it, and deciding, okay, well, that particular thing may not be accessible right now, but these things are, and we still need to take time to have some sort of intimacy. There is, if we're having issues around, pelvic floor, different muscles, tension, things like that, or maybe lack thereof, there is gynecological rehabilitation through pelvic floor physical therapy that can be sought. And so they're the people who are the experts who can really walk you through what's going on with your own body in those realms. For some people, lack of erection or toys can be used to help enhance. For some people, that's not the route they want to go, or it's not an accessible thing, and that's okay. Even penis owners can have sexual experiences with a flaccid penis. And I know that's probably mind-blowing to most people, because we always think that if there is a penis involved in the act, that it would need to be erect, but that is not the case, because again, we are looking at all of the things that are on the table and finding what feels good now and what is accessible now, and embracing that, and really trying to take off that hat that these other things that maybe were accessible in the past, or maybe we see on TV or whatever, but these things are not necessarily the one and only way to make this happen, or to have some sort of sexual experience that is pleasurable, and meets our need for that skin hunger and that intimacy. So there's lots of options out there, but we have to really think outside the box and not keep ourselves confined by a very narrow view of sex or scripts. All right. So again, just because it's a sexual health and well-being presentation, I just want to make sure that we're talking about, one, making sure we're having conversations with partners about barrier prevention for sexually transmitted infections, that we're having discussions around, keeping from having a pregnancy if that's not what we want to have happen, and that we're clear on these things, and that we have the open discussions about wants and needs and where everyone's at, and that safety and consent are very, very sexy things. Another kind of trope that we have in society is that it's sexy if you don't talk about it. However, that usually leads to a lot of assumptions. It leads to people not getting what they need. It leads to more discomfort and confusion. And so we have to talk about what we want, what's on the table, what's not on the table, what might feel good. And sometimes this is a discussion ahead of time, and sometimes this is a discussion during, and sometimes it's both. Because we may need to feel things out as we go, especially with chronic illness, day to day, things may change, and we need to get really comfortable with our partners in having these conversations and advocating for ourselves, and making sure that we're getting what we need, even if that changes, even if that changes in a second, in the middle of everything, that's okay too, because that's just how life is. And we don't talk about that enough, that we have to take off that hat of these things that we think sex is or how it should be, and really remember that this is something that we are co-creating with whoever our pal is at that moment. And just get really comfortable with it. If you get comfortable with it and you lead the way with confidence, other people will see that and they will jump on board. And I know that's hard, because this is not something we talk about. This is not something a lot of people are comfortable with. And I will share with you, that's been a journey in my life. Like, this was not something I naturally was comfortable talking about as a younger person. But as I have gotten into this work, as I have known that this is important, as I've seen people needing to have these conversations in their personal lives, I really encourage people to embrace and start trying out getting comfortable with this. You're not going to get it right the first time, and that's okay. It is totally okay to be weird and awkward and you're really leaning in there. And I really, really encourage you to do that. Life's messy. Being human is quite a dangerous business. And that includes our sexual health. And so we'll just lean into that vulnerability, a little bit of that Brene Brown stuff there. And hopefully we'll get closer to what we want and what we need. So this here is a little bit of a cycle that you may see happening. So it's basically kind of navigating the new situation, right? Post-diagnosis and dealing with all of that. And re-scripting your sexuality and relationships. So if you look here, we start off and we have that fear of concern or discomfort, and then it can spiral down. I'm worried about having sex. I don't know, this hurts. Ow, I don't feel like it. I'm not in the mood, whatever it might be. Then, partner might start making assumptions, like they're okay, I don't want to hurt you. And I'm just going to back away, and then the fears felt, right? And then you're going, oh, okay, they're avoiding me, or they never initiate anymore. This is because XYZ, we make a lot of it. We never have the conversation. We're making a lot of assumptions. The partner maybe is trying to be respectful, doesn't initiate sex, doesn't, and then that fear is realized, right? That, oh, I'm undesirable because XYZ. So we want to not get stuck in the spiral. We want to disrupt this spiral, and we want to engage in the pyramid. So we want to have that base of maintaining that intimacy, which is an essential part of the process of the recovery of, just the trauma of having a chronic illness, of all of that. And so then we want to address our function and feelings. Again, that's the re-scripting. What works, what doesn't work, what's on the table for me now, today, in general, what, do I need to get more in touch with where my body is now? Which can be hard if you have a lot of pain or discomfort in your body, you don't necessarily want to tap in, and it may be harder to find what feels good. So this is a big stretch exercise. And this may not be all the time. There may be days, but being really functional about that in terms of, like, a lot of the time I'm not going to feel good and I'm not going to want this, but maybe we can do some low impact cuddling, or other things that are intentional, which we'll talk about in just a minute, where we get meta. And then again, we're going to engage in intentional sex, and that is not just penetrative sex. That is anything on the table. It's like, hey, I'd like for us to sit and be close to each other. I would like for us to be sitting close to each other and just, have some of that skin contact. Kissing would be fine right now. Would you mind holding my hand? What can I do for you? I could hold your hand. I might be able to stroke you. I have the energy to do that. I don't have the energy to do these other things. And really engaging in that. What is on the table? What is okay? What feels good? What are you able to do? And again, that can change in the moment, and that's okay too. But being very open and embracing that. So here are some of the other things we really want to get into. Part of the intentional sex is understanding love languages. What can happen a lot of the time is that people are going, I'm loving you, and they're working primarily out of their own love language. And you're like, well, that's nice, but it doesn't hit the spot. And so, have we had an open conversation about what our love languages are? There's tons of quizzes online, you could do it, but most people could figure it out by just looking at the chart and figure out what their top love languages are. And then learning how to communicate in the other person's love language, or asking for what you need. It's just a gentle reminder, my love language is quality time. So these are the things, and they're not words of affirmation. So if you have a words of affirmation person and they're always like, oh, you're so wonderful and I really appreciate you and I love that you're here and blah, 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 and part of my life, that's not going to hit the spot if your love language is quality time. And so being able to have that discussion. And then, for other people, and these of course are for people who are partnered or maybe even starting a partnership. You can start off on a good foot and have an open conversation about these things and use them from the start. And then you have the Gottman State of the Union meeting, which it's a good way to check in because, we all are trying to also live life and things get busy and, on top of managing a chronic illness. And so are we checking in? Are we spending time working on the relationship, which feeds the intimacy, which then, sets the groundwork for those intentional conversations so that you can move up the pyramid a little bit. And so a lot of that gets lost in the management of chronic illness and in the shifts of roles. And sometimes we have to, be intentional about coming back to that. But anyway, you pick a time a day. Gottman says you should do this weekly. If that is not on the table, pick a time period that works for you, right? Every 2 weeks, quarterly, whatever works for you. And have your relationship meeting. So talk about what's going well. Do 5 appreciations. And then practice discussing something that didn't go so well. So it says conflict or process an argument, but I always say, what's not working right now, right? Process that and then ask each other what would make you feel loved this week, right? So you're asking for open feedback. Because we don't have good scripts around having these kinds of conversations. There you go. There's your little script. Love that. Okay. Part of being intentional is, if you need some support around that, these are some books that can help. So there's the book about love languages. There's the Come As You Are book, which I mentioned earlier. There's both the book and the workbook. So you can do some discerning. And this is actually science-based, about how all of that works and desire. And she talks about the gas pedals and the brake pedals and all of that kind of stuff. There's the 7 principles of making marriage work. Gottman actually studies relationships in his lab and shows what kind of practices help build relationships and which cycles that people can fall into that kind of tear down some of that foundation. The 4 Agreements is a great book. Another way to be intentional here is The Ultimate Guide to Sex and Disability. So this really talks about sex with disability and chronic pain and illness. And it can help you look at different ways to modify things, different ways to get intentional. It's got a lot of really great tidbits in there. And there's also Assisted Loving, which is the journey through sexuality and aging, but a lot of this is applicable to chronic illness as well. So I don't want anyone to be put off by the title. Long-term relationships, it's, especially through chronic illness, State of Affairs and Mating Captivity by Esther Perel might provide some insights. There's a very accessible Principles of Pleasure. It's a 4-part series on Netflix that's very, very good. Emily Nagoski, whose book I talked about earlier, she is featured in there. And she also has another book that she wrote with her sister that I don't have on the slides called Burnout. That is another one. And that's the one where she really talks about completing that stress response cycle, which again, if we think about chronic illness as this ongoing kind of trauma to your everyday being, it's important that we have those stop gaps and those times to complete that cycle for ourselves. So if reading and concentrating is not necessarily your thing, which for a lot of people it's not, especially if brain fog is part of what you're dealing with. Emily Nagoski's book and workbook are very accessible. They're not too wordy. The Ultimate Guide is pretty accessible because you can kind of look up what you need to look up and not read the whole thing. And then, of course, watching the Principles of Pleasure is a pretty easy and accessible 4-part series that I really, really like. And it talks about, it's very diverse. It is very inclusive and very diverse. And I really appreciate that about it. I've watched it multiple times because it's so good. And I learn something new every single time and go, oh, I have to add that to my work. And then I do. So just a quick overview about intentional sex. Again, this is opening up the idea of what sex is, right? We cannot think about it narrowly. We have to think about it more widely. So any sort of a physical affection or other kinds of affection. So, the love languages kind of play in there. Communication between partners, right? And so those pieces, that's why I include the part with the Gottman stuff, like how do we talk about these things? How do we help, and again, I know like if you have a long-term relationship and you're trying to maintain that, that's important. If you're trying to date or start a new relationship, we want tools for getting off on the right foot. I know that can be putting yourself out there with a chronic illness to a new partner. That can be very, 20 times as vulnerable as, dating in another situation. And so that communication piece, having scripts, feeling prepared on how to discuss these things can really help build that in the right foot. And I always loved this. I read this book when I was working in the HIV arena, and it was about these twins, and one of them had contracted HIV through a blood transfusion. And so her sister had told her, she said, I know you think that dating with HIV is very hard because you have to disclose and, things have to be discussed and modified and all that kind of stuff. And she goes, but it's such a blessing because it's a way for you to weed out people who wouldn't have put in the time and energy anyway. And I thought that's what a wonderful way to kind of flip that to a strengths-based thing. So it can be a litmus test in a good way. And so I thought that was just a really nice way to flip that for anyone who's dealing with some sort of chronic illness that they need to navigate in the dating arena. Intentional sex it requires a lot of patience. It's slower, it's more communication, it's testing things out, and giving feedback in the moment. It's creativity, is certain positions may not be as accessible at different times. And so, are there chairs or wedges or pillows or other supports that can make this more comfortable for everyone involved? And we have some other tools that I'll talk about in a minute that might be able to help you be more creative. Of course, there's cuddling, there's kissing, different kinds of, touch and what do people like? So I was talking about, like, if you like to have your back stroked, is it up and down? Is it with this kind of pressure? Is it in circles? And that's anywhere, that can be anywhere on the body. You can test some of those things out to see what works and what doesn't work at different times, what feels, because everybody is so different and it may change day to day. What worked yesterday may not work today. And then, of course, we can think about any sort of non-penetrative sex. If penetrative sex is just too much of a physical lift or uncomfortable in any way, then you can think outside the box there with some non-penetrative sex. So you could talk about, any sort of oral sex or manual manipulation or mutual masturbation, those kinds of things. Lower impact, if you will. All right. Tools, and these are just a few that I've added to a slide. There's lots and lots of different kinds of tools out there. Lubrication, Uberlube is a really great one. It's quite appreciated in the sexual health circles. It has stuff that shouldn't be irritating to most people. And it has a good, it lasts, if you will. And so that's a good one. The ONA buffer rings, those are things that can help make it so that if penetrative sex doesn't feel good because of depth. It can make the depth a little bit less, and you can customize that. If working on the pelvic floor, perhaps dilators may be needed through pelvic floor physical therapy. If you have any sort of things that scar tissue, adhesions, other things, areas, different kinds of massage may help with that. Show and tell and body mapping. So show and tell is basically you talk about everything that's going on with you, scars, wrinkles, tattoos, extra skin, inflammation, all of that. You talk about it and you get really real about what's what and what's where, and kind of are radically honest about your body with a partner. And then you lean into that. You embrace each other for what you bring and who you are in that moment. Because remember, all bodies deserve pleasure. It doesn't matter what you've been going through. It doesn't matter what you look like. It doesn't matter how much you weigh, how bloated you are. None of that matters. Your body deserves pleasure. That's another area where we think very narrowly, and we are fed messages constantly about who is deserving of pleasure and who is deserving of a sex life that is fulfilling. And a lot of our mind work is around unscripting that and remembering that all bodies deserve pleasure and experiences that they consent to and that feel good. And then body mapping is where you kind of what we talked about earlier, where you go around and you kind of figure out what feels good. So what are your erogenous zones and what kinds of touch feel good there? It's time to be very present and real. It is not rushed. It is goal free. There are no goals. We are not trying to get in any pinnacle. You do as much or as little of that body mapping at a time as you can. It's really being present in the moment with the person you want to be there with, or even with yourself, because a lot of this can start with just you, so that you start to get very, very comfortable, especially if you've never done some of these things before. Get really comfortable with you. It's all based on the sensation and the experience. It is not performance. We're not expecting anyone to perform. Sex is not and should not be viewed as a performance. That's another area that we kind of have to take off that idea and remember to kind of fill it in with ideas about sex that are healthier and more sustaining. And then, of course, general health and nutrition all help support this, right? No one thing is going to get you there, but general health and nutrition will help support all of this. Just another reminder that sex is for pleasure, and this is all kinds of stuff. And so as a culture, we don't acknowledge this enough. Again, there's a lot of shame around the idea, especially when it comes to pleasure for vulva owners. There does tend to be a little bit more focus on that for those who are penis owners. And so, we don't typically center our discussions around here, but again, in my bio, you heard that I was sex positive, and this is part of that sex is for pleasure, and that's okay. So I just want to touch on this real quick, because I think this really helps with some of the getting intentional and the body mapping and the, because here's the fun fact. Most people do not realize the full anatomy of the clitoris. And it is an analogous anatomy to the penis. So you can see here in this, most of what's even in medical textbooks was just that glans clitoris. So just the very edge that's external and the outside piece. But there's a whole lot more to that entire organ that's internal that people don't really realize. And again, nobody should flog themselves for not knowing this, because mainstream science had not even acknowledged the full anatomy of the clitoris until 1998, when it landed in one medical textbook, one. in 1998. So historically, as a society, as none of us carry this as like the common historical knowledge of what a clitoris is, but there's a lot more to it there than we realize. And if you look, it is analogous to the entirety of the penis, which is more external. So it's a little bit more obvious to the naked eye. And then it's important to understand the sexual response cycle. Now, of course, this can be interrupted, or certain things may be going on with your body that make any one of these phases longer than the other. But it is important to understand this. So it's the excitement, the build, there's usually a plateau and orgasm and then resolution. Not all of these parts may always be accessible, and that's okay, because again, remember, we're remembering that sex doesn't have to end in orgasm for it to be sex. It doesn't have to be goal directed. It just needs to be pleasurable. So what is happening should be pleasurable to the people that are involved. However, that doesn't have to be orgasm. So it should be a pleasurable, intimate experience. And then choosing the path forward. So what are you going to do for yourself? Think outside the box when it comes to sex and intimacy. Address physical barriers, and if your doctors don't believe you, find someone who does. Not all doctors or practitioners of any sort are comfortable with talking about the sex side of things. And unfortunately, they're probably not going to be the ones to bring it up. So if you don't bring it up as a problem and push for it, you won't ever test to see if they're comfortable and see if they might be able to help you work through some of the things that you're experiencing. Because there may be options for you that you had not previously explored. You want to rescript the how. What works for you now? And then ease into it. You're embracing new things and you're learning to lean into the vulnerability of it all. So we want to choose the path forward, right? Therapy, if you want to address some of these anxiety, depression, things that are coming up around living with a chronic illness, or any of that stuff that we talked about around the losses, lifestyle change, what kind of medical interventions, aids, pumps, dilators, pelvic floor PT, medications, other interventions. Again, practical adaptations, so addressing fatigue as best we can with our doctors, using things like different chairs or props so that you're sitting or laying in different ways, lubricant for vaginal dryness, and then of course any sort of toys or other functional aids. So we start with you and your perceptions of coping, because like it or not, the brain is the most important sex organ, and then we move into the more practical, concrete support there. And then considerations for the uncoupled. So of course, we want people to have as much social support as possible, because we know people do better when they feel socially supported. We don't have control in our lives over who steps up, how they step up, and we don't have control over. The only thing we can control is the mindset of how we're going to respond, right? We have control over our internal state. It doesn't always feel like that. A lot of responses are learned and practiced over time, and they feel very automatic. But with work, and if you need support from a therapist, with work, you can help to identify those patterns in yourself and re-script a different way of responding. There's value in different kinds of relationships. We can take control of the narrative and address the elephant in the room early. So that's that leaning in, that vulnerability, that's setting our boundaries, letting people know what we do and do not need. We can rescript non-reciprocation as a guidepost. So that was that story I was talking about those twin sisters, is you want people to fit in your life that can handle what your actual life is. That is what we all want. And you shouldn't have to be any different than you are, because there's no way to be any different than you are when it comes to a chronic illness like that. And so embrace it. This is who I am. And then who's going to step up and be prepared. Again, those scripts, how to talk about it, how to have difficult and sticky conversations. You know, and I hope I've given you some tools and some books that can help you look into some of those and get your own, what feels right and true and authentic for you based on kind of those models. And then, you know, touch is powerful. Identify ways to fulfill your need for pleasant, comforting touch. And so that's some of that skin mapping and the show and tell and all that kind of stuff, and even starting just with yourself. And so I end there, and it looks like, I don't know if we have any questions, comments, needs, things you'd like me to address.
Thank you so much, Jillian. I don't actually have any, I have some questions that were submitted earlier, but I feel like you got most of them and we are almost out of time. So I just want to give people a chance to, if you do have a question, just go ahead and send that through the chat. And we got a very nice comment. Just wanted to say that this was the most helpful seminar I've taken in a long time. So thank you very much. That was very nice.
Thank you, Stephanie. I appreciate that very, very much. You know, there's a lot of tools out there, you know, and this isn't your individual therapy. So I had to stay broad, and you guys did have some specific things, but I hope that you have some tools to go out and empower yourself to navigate and get what you want.
Yes, thank you so much, Jillian. So I am going to, again, thank you for this webinar. It was really great. It was super illuminating. And I hope that everyone really enjoyed it. As you guys know, we always provide a recorded version of this webinar, and you'll get that in an email, follow-up email along with the slides and any links that we provide. I'm going to drop a bunch of links right in here for you guys as well. For some of the things I'm going to talk about. If I can get the chat to come up, I will drop the links in there. There we go. So as a reminder, we really do value everybody's feedback. We love receiving feedback. Please complete our super quick survey for this webinar. For those of you using Zoom in a browser, it will automatically take you there once you leave the webinar. If not, it will be added into the chat, which I added there. And if you please click on it, the first link there, it will launch to complete the survey, and we really do appreciate that. I also want to remind folks we have more education webinars before the end of the year, so you can sign up by going to stopsarcoidosis.org/events. And if you haven't already, please join the FSR community to stay up to date on news, events, and clinical trial opportunities. We are excited to share new opportunities to make a difference in the sarcoidosis space. So we are currently looking for volunteer community outreach leaders and volunteer support group leaders to work with FSR's 38 Global Sarcoidosis Clinic Alliance members across the country. You can learn more about those unique opportunities by visiting our website. And all patients can take research into their own hands by joining the FSR patient registry, where your voice matters and helps us and researchers understand this disease. There is also still time to participate in FSR Stopping One Snowflake at a Time program. Together, we can create a blizzard. So we hope you will join us in raising awareness through sharing your snowflake story and participate in year-end fundraising. To learn more about Stop Sarcoidosis One Snowflake at a Time, you can visit our website. And finally, we must thank our donors for their continued support of FSR. We cannot provide programming such as this webinar without their support. If you would like to help us ensure that this kind of programming remains free of charge for all patients and their supporters, we hope you consider supporting FSR. We have a variety of ways to show your support, and you can find out more on our website, which I added as the link as well. So thank you all again for joining us today, and a special thank you to our amazing Jillian Bisar for this fantastic presentation, and I hope everyone has an amazing evening.